Bipolar disorder has kind of changed over the years I've been practicing since, say, the early 70s. Back in the old days, bipolar disorder, well, let me back up. Bipolar disorder is a condition that has episodes of depression and episodes of mania or hypomania. I'll talk about those in just a minute. The more common of the two are the depressive episodes. So most patients with bipolar disorder may have one or several hypomanic or manic episodes, but may have many repeated depressive episodes. And sometimes it's a depression that shows up before the mania or hypomania. Mania and hypomania involve people looking high, too energetic, too anxious, too angry, too full of themselves that other people think they're not their normal selves. And these episodes last for usually days or weeks on edge. And it's not that someone will go from a very high to a very low to a very high. Often what happens is there's a period of normal mood, and then there are episodes of depression. Sometimes depression may show up long before the first high or manic hypomanic episode shows up, and it may be mistaken for just a major depressive episode because there's no evidence yet of other symptoms of bipolar disorder, although when we look back, we often find there are clues there. So back in the early days when I first started, the highs were difficult to miss. People were truly manic and psychotic. They would be grandiose. They would be euphoric. They would think they were the Messiah or the Savior for the earth, or that they were fabulously wealthy, and would do things during those periods of time that were so out of keeping for themselves that it was hard to miss. Often they became grossly psychotic, out of touch with reality. They were so high and grandiose. Nowadays, we don't see that severe high, that mania, like we used to. What we see instead is hypomania, where patients are kind of high. In fact, sometimes they feel great. Too great. They get a lot done. They don't need to sleep. Their speech is too rapid. Their thoughts are coming a mile a minute. They may engage in risky behaviors, but they may not be so psychotic that other people notice right away. Their family members usually notice they're not acting themselves. So that's the high part. Then they may go to the low, or they may go back to normal, and they may stay there. So when we look at people with bipolar disorder today, in general, when they're symptomatic, they're either high or low. About 60% of the time when they're symptomatic, they're generally depressed and not manic or hypomanic.